Welcome, AP Psychology students. This video is going to be over Module 72. The big topic here is looking at how effective are the different therapies from client's perspective, from clinician's perspective, and so what's the answer to that question, and how do we come to those conclusions? So let's get to it. So is therapy effective? So we think about from a client's perspective, generally what we find is most clients feel that their therapy is effective. And so what could be some reasons that maybe inflate the perceived effectiveness of therapy? So one of these here, it says regression to the mean. When we say regression to the mean, if we see results in a study that are much higher or much lower than the average, we can assume that later results are going to be closer to the average. So you think about like a basketball player. If they average 10 points a game and all of a sudden they score 37, how much are they likely to score the next game? Statistics would say close to 10. They're going to regress. They're going to come back to their average because that 37 points was an outlier. Now, what does this have to do with therapy? So when people come to see a therapist, they are generally mood-wise, they're at their worst. Their depression is really low, their anxiety is really bad, etc. A lot of people will improve over time, even without therapy. So even if you don't go see a therapist and you're really depressed, generally your mood will improve. Now, the people that get therapy do better than those that don't get therapy, but even without it, you're going to see an improvement. So if you start really low down here, you're going to end up coming back to your average baseline mood. So some of the improvement may be due to that regression to the mean. Rationalization. This is kind of like, cognitive dissonance, kind of justifying to yourself, why am I spending all this time and this money on a therapist? So sometimes people have to kind of talk themselves into the idea that, hey, yes, this therapy is good, it's working, totally. And selective recall, just this idea of like, you remember the good parts about therapy, you don't spend as much time thinking about maybe the less helpful parts of therapy. From a clinician's perception, so like from the therapist's point of view, they tend to remember the successes they've had with clients more so than the failures. So if they talk to a patient and then maybe the patient is done seeing them and then maybe they hear from them later on and they remember the good stories, not so much the ones that, it didn't work out very well and so they ended therapy or they went somewhere else. So kind of like a rosy retrospection. We remember the good more so than the bad. And to kind of get into the nitty-gritty, how do we figure this out? How do we know if a therapy is effective? Most commonly, we use what are called randomized clinical trials. So this is doing experiments, basically. You have some people try a given therapy and you have other people do nothing, or you have some kind of a control that you compare it to. Oftentimes with these kind of studies, you'll have one group of people do nothing. You might have another group take medicine. You might have one group do the therapy, and you might have another group do medicine and the therapy, and they would compare the different levels of the independent variable and see, which combination is most effective and how different those results are. They're also going to look at what are called meta-analysis, which all that is taking several studies, several randomized clinical trials and comparing them, putting all the results together and having one kind of mega result. So, hey, we've looked at these 20 studies about the effectiveness of this certain therapy, combining the results, the meta-analysis says this. So it's just a way to kind of get a bigger sample size, basically, and, kind of add all the results together. This is just showing you the overall, how do people that get therapy do compared to people who never get therapy. So the average untreated person versus the average person who gets psychotherapy. And so what we see here is that 80% of untreated people have poorer outcomes than the average treated person. So can you get better without therapy? Absolutely. Although the research would say that those that get therapy tend to get better quicker and have overall better outcomes. Again, this could be kind of correlational. There could be other factors at play too. Maybe people that can get therapy maybe have other environmental factors, maybe lower stress, or maybe they're socioeconomically better off. And so there could be other factors, but this is what we know, is that people that do get therapy tend to do better than those that don't. The reading goes into a couple of alternate therapies. These are just, kind of interesting, but one of these is called EMDR. It stands for eye movement desensitization and reprocessing. And for many years, it was kind of thought to be kind of bogus, and no, this doesn't really work. It's just like a placebo effect. But I tell you what, the research just keeps coming in, and there's clinical evidence that it does work. There's still kind of up for debate as to why. Some people think it's more of just like an exposure therapy, or just so what they do is you would go through past events that were anxiety provoking or traumatic, and the therapist would have like their finger or some kind of object, and they'd be moving it back and forth rapidly, and your eyes would follow. And so again, some people think it's just exposure therapy, but from what I've heard from some therapists that use it, the idea is by moving your eyes back and forth, you're activating both hemispheres of your brain, and it somehow moves the memory from more of the unconscious part of the brain up to the conscious so it can be processed. So bottom line, they think that the moving of the eyes kind of reprocesses the memory. And by doing that, you're able to kind of think it through, and it reduces trauma. Again, you can see there's a lot of information out there, and so we don't quite know 100% why it works, but hey, the clinical trials show that it does. So if you have anxiety issues or trauma issues, this has been a proven, well, as proven as you can make it, therapy for those conditions. Light exposure therapy, we've talked about this during the discussion on depression, how you can use light exposure therapy for seasonal affective disorder. What's going on here is the light from the light boxes activates these proteins in your retina, and it causes a chemical reaction, and at the end of the day, more serotonin in the brain is produced. And so clinically, these have been shown to be more effective than placebos as well. So give it a shot if you have seasonal affective disorder. Some of the reasons that psychotherapies might be effective, and some of the commonalities among different types of therapies, because we could sit here and argue all day like, hey, which one is better, cognitive or humanistic or whatever. But at the end of the day, there's three key things that all of these therapies have. One, they're giving hope to people who are demoralized. Again, a lot of these people are coming in when they're at their lowest low and they need help, and they just need someone to give them some hope. You're getting a new perspective. It's very easy to think like, well, I know myself best and I don't need to hear what somebody needs to say. But oftentimes seeing a therapist, just having a different way of looking at a situation is really helpful. It's helped me many times when I've seen a therapist. And then just having someone who listens to you, that you trust, someone who kind of cares about your issues. It's nice just to have someone, sometimes when you go to therapy, just to vent to, and just to sit there and kind of listen and help you talk through your problems. These are just some of the differences between some of the, if you're looking at going into being a therapist, or you just want to know some of the different titles there. You can see the differences in education that you need to attain to have these jobs. The biggest one I'd want you to know is just know the difference between a psychologist and a psychiatrist, and that is that psychiatrists can prescribe medication. Although there are some states that are starting to allow, at least on a trial basis, for psychologists to prescribe some medications. To be fair, though, too, Just because someone is a psychologist doesn't mean that they're a clinical psychologist. So, there's all kinds of psychologists that work in fields like memory and, other things. So it's got to be a clinical psychologist who's dealing with people with mental illnesses. A lot of people who are therapists, they would go and get a master's degree. They would have like a master's in social work or counseling. And they, after 2 years in graduate school, they would have the ability to work as a therapist. And what they found is that the level of education obtained does not seem to predict how effective they are or the difference that they make with their clients. So something to think about. And then finally, just looking at like preventative measures, what preventative measures can we take? You just kind of want to know the difference between primary and secondary. So primary prevention, if we're trying to stop people from getting disorders, let's try to protect healthy people from even getting a disease. You kind of think of the story of, there's these people by a waterfall, and there's people that are coming down the river, and they have to pull them away so they don't fall down the waterfall. And one of the people gets up and runs upstream, and people are like, "What are you doing? These people are coming, they're going to fall off the cliff." He's like, "I'm going upstream to see why people are, coming down to the waterfall. Why are they ending up here anyway?" So it's, they talk a lot about upstream prevention. What can we do early on to prevent people from getting sick in the first place? And then secondary would be, how can we intervene after an illness has been diagnosed? So how can we mitigate it to make sure that it doesn't get worse? So just some good things to know. So hopefully by the end of this video, you know that therapy is thought to be effective, that there are some specific therapies that are best for specific illnesses, and then why the perceptions from the therapist and the client could maybe distort how effective a given, therapy session is. So thanks for listening, and we'll talk to you soon.